The Royal Caribbean cruise passenger does not have COVID-19.
That's right, the 83-year-old Singaporean man had tested positive while on board the Quantum of the Seas, but the Health Ministry said that his final test taken today confirms he doesn't have the virus.
This confirmatory test follows two PCR tests conducted yesterday by the National Public Health Laboratory. One was a retest of its original sample and the other on a fresh sample taken yesterday. Both tests came back negative.
MOH also said it has rescinded the quarantine orders of the passengers' close contacts who had earlier been placed on quarantine as a precautionary measure while investigations were ongoing. The ministry will also support the laboratory on board the cruise ship in its review of its testing processes. Meanwhile, the Singapore Tourism Board said Singapore's pilot for safe cruises will continue as planned.
Let's get an expert's opinion on this. Joining us now is Professor Teo Yik Ying, Dean of the Saw Swee Hock School of Public Health. Professor, confusion resulting from the cruise passenger testing positive while on board. What is this PCR test on the cruise? Is it robust enough compared to the ones used to generate results by labs?
Thanks for having me back. I think we will need to wait for additional information to be given on what PCR testing protocol is being deployed on board the cruise ship. I suspect it is likely to be one of those point-of-care PCR tests rather than what we've been hearing about usually, which is the real-time or the RT-PCR test. The reason for her differentiating between the point-of-care PCR test and the RT-PCR test is that if it is indeed the point-of-care test, some of these tests do perform slightly poorly compared to the real-time PCR test. And when I say perform slightly poorer, it means that the ability to find a true infection as well as the ability to correctly identify someone who is uninfected tends to be a little bit lower. It's just a little bit lower. So the real-time PCR test that we've been hearing about all this while is much less likely to make a false positive or a false negative error. But actually from an objective assessment, much less likely doesn't mean it is a perfectly accurate test as well. So one important highlight here is that there is indeed the possibility that the testing protocol used on board may have a slightly lower accuracy, and we do need to wait for further information to clarify on this.
Now, Prof, two subsequent tests came back last night with negative results, suggesting the initial test could be a false positive. We know tests do generate false positives, but what is a false positive and how can it happen?
So a false positive refers to the situation where the test indicates that someone is infected, but actually the person is healthy and doesn't have any infection with the SARS-CoV-2 virus. So this can happen because some of the tests do have inherent errors that can occasionally, by chance, produce a wrong result. And this is what we always define as the testing performance of, the performance of the test. The test can yield a false positive error, which what we have seen here, it applies in this particular case. But at the same time, there are tests that can produce a false negative error. And I suspect in both situations, we are working very hard to ensure that we minimize such errors, because it's clear that there are huge implications regardless of whether it is a false negative, in which case someone who truly is infected is let loose to circulate and mingle around in the community, or a false positive where there will be implications to cruise ships turning back or people who are actually healthy being prevented from partaking in activities or going up a plane or a cruise ship, for example.
Right. Well, let's throw back to what happened yesterday, Prof. From your observations, how do you think Royal Caribbean handled the entire situation? Any protocols you think that need tightening?
I think yesterday's situation highlighted that the protocols that we have in Singapore, not just for Royal Caribbean, I believe for all cruise liners, is a very prudent one. The moment that someone tests positive, the priority is always focusing on how do we protect everyone else on board and to minimize the spread. So I do think that highlights that the current protocol that we have works, and it's one that prioritizes safety and well-being of everyone on board, particularly the passengers. In terms of protocols that need tightening, I suppose given that we may potentially be seeing an erroneous test result, I think that's where we need to look into the validity and the deployment of many of these tests, particularly those rapid tests that can yield results in a very short time. Because we do know that some of these tests, the speed comes at a compromise for the accuracy. And we have already discussed how errors can have very big impact on both the economic implications as well as the safety implications of passengers and people on board.
Now, if anything, Prof, yesterday's sequence of events was a necessary test for the Safe Cruise pilot scheme. But do you think there were any negative repercussions?
Well, clearly to those passengers who were on board, their holidays were cut short, and there was quite a significant degree of fear amongst those who may have already been in contact with the supposed infected person. But I think coming back to the point that it highlights that the management system that the cruise industry has put in place at the moment is able to safeguard the well-being and continues to prioritize that in such a situation. And I do see this to be an important lesson that we will have to take as we move forward, because it will not just be the cruise sector, the cruise industry that will encounter some of these false results. There will be other settings, including Singapore hosting the World Economic Forum that is coming up in May. We are opening up our nightclub activities, our nightlife activities. More meetings and conventions and conferences will happen in Singapore, which will rely on greater degree of test. How we handle the false positives that occur is just as important as how we handle the false negatives. Right now, I'm actually quite confident that the protocols that we have in place in Singapore is able to handle some of the false negatives. False negatives means that we accidentally let in someone who actually has an infection, and that person may go on to spread the infection to others. We may have primary, secondary spread, but the contact tracing, the ring fencing that we have in Singapore at the moment, I believe is very watertight. It will help to manage the problem of false negatives. The issue with false positive is one that is trickier because it sends a degree of fear. It sends a degree of what do we do with the event or with, for example, the cruise ship or a plane load of passengers. Those are some of the protocols that we do need to learn from, and also perhaps implement additional tests whenever we are deploying some of these rapid tests and we find a positive result.
Right. Well, good points as always from you, Professor Teo. Thanks so much for taking the time to speak with us today. We've been speaking to Professor Teo Yik Ying. He's the Dean of the Saw Swee Hock School of Public Health at NUS.